Hello, everybody. Welcome to another episode of You're the Cure. I'm Dr. Ben Edwards. We've got a great show today. We've got a repeat guest, Dr. Tom Cowan, with us. You can go back on our archive page on our website, veritaswellnessmember.com, and just go to the podcast page, hit the drop-down menu that says guest name, and you'll see Tom Cowan's name, I think 4 or 5 times on there. We've had him on over the years. I wanted to bring him back on today to reintroduce him because we have so many new listeners, so many new followers since we launched our new online wellness education platform. And the purpose of that platform was to keep you out of my office. We have a long waiting list. And the name of this radio show and podcast, You're the Cure, isn't a gimmick. I actually believe that. I named that show 10 years ago when I had a local radio station owner come to me and just ask if I'd come in on Monday mornings and do an open line Q&A with the local community on his AM radio station. So we've been doing this for over 10 years now, and You're the Cure became real obvious to me within about a year or so of me being introduced to some other theories in medicine, theories beyond the standard American conventional theory that I was taught at UT Houston Medical School, where I graduated in 2002, chief resident at Waco Family Practice, learning great conventional medicine. But then my eyes were open at those great convention, and I'll put great in quotations there, those great conventional medical model theories and treatment protocols based off those theories produce the worst outcomes in the entire world. In the industrialized world, we are the sickest, dying the youngest, and then paying the most for it all along the way. I didn't know that. And most patients don't know that. A lot of patients have opened their eyes and woken up over the past 2 to 3 years. It's become more obvious to a lot more people. So I thought we'd go back to an old topic. Dr. Tom Cowan's been on before talking about his book, Human Heart, Cosmic Heart. Here it is here. If you don't have it, get it. I believe we carry it in our store. And drtomcowan.com is his website. And I wanted to go back to this topic, and I'm sure we'll go to other topics too, but I wanted to hammer home the fact that the number one killer in America, what I just pulled it up, CDC's website, this is data from 2021, heart disease, number one, 695,547. Used to be it was closer to just 600,000, and cancer was almost catching it. And now cancer is about 100,000 below, or heart disease has jumped up 100,000. We might talk about the relationship with that and a new product that was introduced to the market, and everyone was encouraged / coerced / forced to take here in a minute that might be driving that heart disease number. But I still have patients coming in every week under the idea that cholesterol is clogging their arteries like pouring bacon grease down your kitchen sink. It just builds up and clogs your arteries and you have a heart attack. But I'm just real briefly, I'm going to tell you, Ansel Keys, back around 1958, 59, 1960, he came out with his theory. And that's what I want to stress here. It's a theory that saturated fat clogs your arteries and causes heart attacks. And the study that he produced was a fraudulent study because he cherry-picked the data. I'm not going to go into that now. The very second study after that, the Minnesota coronary artery disease study, showed the same thing. You can start eating vegetable oils and you'll drop your LDL, but you increase mortality rates. For every 1% drop in LDL, you increase mortality by 1%. So it was clear early on. And by the way, then they didn't publish that study from the 1960s until 2016. I'll go through all that data and all that hidden data and the truth of the data, including up to American College of Cardiology Journal, August of 2020. They conclude in their review study, saturated fats have no correlation with cardiovascular disease. But every single week, I have folks coming in here on a statin. I had one lady in particular. This is really what drove me to call Tom again. She walked in here, Spanish speaker, elderly lady in her 60s. Her daughter brought her here. Her daughter's a patient here. And real sweet lady. I talk a little bit of Spanish, so I tried to break the ice. We had a good little talk, and then I used her daughter to translate. And we did a good 2-hour visit like we always do on a new patient. And I could see the fear all over her. When we finally got down to it, I found out the fear was she was so worried what I was going to tell her about her cholesterol. Because some doctor many years ago had told her cholesterol was so high she was going to die any moment. It was awful. Put the fear into her. And she told me on her drive up here, she lives about an hour and a half south of here, she was praying the whole way. And her husband called all the family, the aunts, the uncles, the cousins, the siblings, to pray about her cholesterol report from her doctor today would be good. It was a true fear. And so many people are walking under that fear. So, like I said, I'm not going to go through all that data. What I want to do is give you another theory. And medicine is beautiful, or it should be, that we're exploring, we're looking into things, we're thinking outside the box, we're testing a hypothesis with true experimental data. And then if it doesn't come to pass on our experiments, okay, we keep looking. And then we understand that there's things outside the physical realm that we can't exactly measure, touch, taste, and feel with our five senses. And how does that interplay? Because we're not just a physical being, there's a spiritual component. There's a lot to this. And I could go on for an hour, but we've got Dr. Tom Cowan with us today. I want to bring him in to touch on his theory of heart disease and whatever else he wants to talk about. Tom's an amazing physician, amazing human. If you've heard him talk in the past in his books, I'm just going to throw his other ones up here real quick too, because I encourage you to get all of them. They're easy reads. They're outside the box. These are two different ones: Cancer and the New Biology of Water, Vaccines, Autoimmunity, The Changing Nature of Childhood Illness. And then I think this is your latest, Tom. The contagion myth, why viruses are not the cause of disease, which I was preaching all through COVID, got me banned off Facebook and YouTube, that it's more about your terrain than it is about the germ, and it's sure more about your terrain than it is about the gene. So it's not the gene, it's not the germ killing you. Mostly it's deception that's killing you. Tom Cowan, welcome to the show. Thank you for joining us today.
Thanks, Ben. Thanks for having me again. Although I must say, I'm going to start this off by disappointing you a little bit. Because, I'm not going to, I may at the end a little bit, but I'm not going to push a theory.
Okay.
Because here's, if I may put my 2 cents in, which I guess the reason why I'm here. We've all learned a lot in the last 4 years, I think. I certainly have. In fact, I think I've learned more about life and medicine and biology in the last 4 years than my entire 63 years before that. So I'm going to say something now which may surprise you, and you may even disagree with, but maybe not. And I'm going to include myself in this statement, which is the problem that we have right now. You said deception, which I think is interesting. But I would say that we have an American population, in fact, a worldwide population, that's scientifically illiterate. And amongst the most illiterate are the scientists and doctors. They are literally illiterate. Now, that's a strong statement, but it has to do with your comment about I'm going to present a different theory. So 5 years ago, I would have said that's right. But now what I learned is, and I would be happy, Ben, if you, at any point, if you disagree with what I'm saying, that we can have an interesting conversation about it. What I have learned is the essence of scientific, logical, rational thinking is that when some party makes a claim, that the claim needs to be investigated and attempted to be falsified on its merits, regardless of whether anybody has a different explanation or theory to explain that phenomenon. Let me give you an example. I got this from a friend of mine. Let's say you're 18 and you somehow go into your parents' closet and you figure out that you see a bunch of adoption papers and all the papers signed, et cetera, that says that you were adopted and you've never heard of that, right? Because they never told you. And it's very clear, the papers are all there. You go to your mother and father and say, hey, and in fact, you wondered because you look Chinese and your parents are, European. So you've sort of wondered about this. And you go to your mother and say, is this true? I saw these, yeah, we got you from China and you were adopted and and we just didn't want to tell you, we were waiting, right? That's the scenario. Now, you go to your friend next day and you say, I found these papers. I go to my parents, they confirmed it. And he or she says, yeah, but Ben, who's your real parents? You say, I don't know. I don't know. I just found out yesterday. And I think they were from China. And in fact, I may never know. And that friend says to you, I don't believe you were adopted until you can tell me who your real parents are. That, I would submit, is ridiculous. Agree?
Agreed. Yeah.
That has nothing to do with it. So, for instance, a scientifically illiterate person says, okay, I don't agree that heart disease is caused by blocked arteries or cholesterol or plaque. And they say, so what does cause heart disease? That is a scientifically illiterate person. And unless we can figure that out and overcome that, what I've learned in the last 4 years, and I used to do the same thing because I was illiterate myself until I got educated by some very smart people who know about logic, thinking, and science. That there is no responsibility to come up with a different theory. And in fact, I would go so far as to say the magic of life, or in other words, how to learn things, is to falsify claims and then stay in that period where you don't know what the answer is. You just don't know. You don't know why you were adopted, who your parents were, what happened to them, whether they're still alive. You may not know why there's heart disease, but you can investigate. And the one that I've gotten into these last 4 years, people claim there are these particles called viruses, and they cause disease. If you ask them, how do you know? How does a virologist prove the existence of a virus and show that it causes a disease? And I would actually ask all your listeners out there, go to your primary care doctor or your infectious disease doctor and ask them that question. They will usually say, well, what causes chickenpox then? That's not a scientifically literate person. The issue is, prove to me that there is this particle, that it causes this disease called chickenpox. Chickenpox is a specific, diagnosable, specific disease entity. And I can guarantee you, not only will they not be able to prove that to you, they won't even know how you would go about proving that. That's a scientifically illiterate person. Now, if you want, we can go to the heart disease using that way of thinking, right?
Yep.
You want to, by the way, I just want to stop. Is there anything that I said there that you don't agree with or find?
No, I agree with you, because actually I've kind of, through a different way, been thinking just more in general terms about the people, the commoners, or back in the day, the peasants, and thinking from a religious standpoint. The Bible was never interpreted from Latin into English or where the commoners could read it. You had to have a priest between the commoners and God. And then Enlightenment came, Reformation. The Bible got translated. The people got burned at the stake for doing it. But all of a sudden, there's this breakout. We can actually read this. We can have our own relationship. We don't need anything between us. Okay, well, then here comes this whole Enlightenment period. And in a way, it seems to me, looking back, because scientism is a religion in the way I would see it. And now we've put a scientist, doctor in between. The commoners can't relate to this. And I'll throw commoners as the doctors, because, I mean, it's one thing to be, trained like me. I was okay in academics. Mostly I had to work really hard. I wasn't a photographic memory guy, so I consider myself a blue collar guy. I got through med school, wanted to just help people. I was busy just memorizing the stuff for the test, following the doctors around the hospital, writing the protocol thing down, and now realize I was just a protocol pusher. And that's what people don't realize. I was illiterate, completely illiterate.
Yeah.
And I know the system that produced me is the system that produced all these doctors. But as far as patients go, and the folks listen to this show, they feel like we've got to look to a guy in a white coat or PhD at Harvard, ivory tower. And so, we're just illiterate. Well, in part of this conversation, I want to encourage people.
But they're illiterate too.
Yes, exactly.
That's the problem. And so
Yeah.
if you out there want to protect yourself or live a better life, I would contend that when you make decisions based on a belief system in a concept that is false, that has been falsified, it will always lead you into trouble. So let's do. Here's another principle here. If you have an explanation for something that has more than one probable cause, one probable explanation, you can never use that as proof. Let me give you an example. Your wife comes home late, therefore she's having an affair. Well, could be she got a flat tire. Could be she decided to stay at work late. Could be she went out for some coffee. Could be she just felt like taking a drive, right? All those are possible. You can never use that as proof that she's having an affair. Only a illiterate, illogical person would do that. Now, let's go to heart disease. So the first thing you do is find the claim, right? That's the essence of science, is falsifying claims. So the claim with heart disease, now we're talking about heart attacks, right? Because
Yep.
there's rhythm problems, and that's different. So we're talking about heart attack. The claim is, number one, we have 3 major coronary arteries. Claim number 2, all the blood, or the vast majority of the blood, goes through those 3 coronary arteries. Claim number 3 is those arteries get blocked with plaque. Claim 4 is when they get blocked with plaque, the blood can't get through, and downstream you get decreased oxygen, therefore you have a heart attack or necrosis of the tissue. Those are the claims, right? Does that sound reasonable?
Yes, it does. And statins are going to fix all that.
And so you give that. Therefore, because those are the claims, you can do something to get rid of the plaque, and that will help you not have a heart attack, like bypass it, or stents, or statins, or something. Right? We're good?
Yeah, good. Tracking.
Okay. Now, I'm going to ask you some questions here because it'll make it more fun for me. Do you agree that all the arteries in the body, like the hepatic artery, the coronary arteries, splenic arteries, are made of the same thing?
Agreed.
There's no theory, I know, no observation that says you got this coronary artery and it's made of fleece, and the hepatic artery is made of chicken wire or something.
Right.
Right?
All the
They're
same.
all the same.
Yep.
Now, what about this? Do you think that the blood that goes through the hepatic artery, splenic artery, femoral artery, and coronary arteries is all the same blood?
I think so.
As far as I know, yes. In fact, I don't think anybody thinks differently. Therefore, if something is precipitating from the blood into the artery, right? That's what we're told. It should do that in all of the arteries of the body.
Right.
Right?
Yeah.
And in fact, you do get plaque in the hepatic artery, splenic artery, femoral artery, renal artery, and coronary artery. Right?
Yeah.
How many people do you know who've had spleen attacks?
Probably none.
I've asked probably 100,000 people in various forums. One person raised his hand. He was an ER doctor, and he thought I meant like a splenic rupture, which does happen. Nobody that we know of has ever had a spleen attack. Now, do you know anybody personally or heard of anybody who's had a heart attack?
Yes, quite a few.
A lot of them. I know thousands. So how is that possible? If it's the plaque in the same artery in the same blood, and all the other organs besides the heart and the brain don't have attacks, how is that possible?
Good question.
Okay, so that's a problem, right?
Yeah.
Now, here's the next one. Remember, we agreed that all the blood to your heart goes through those 3 arteries, right? Guy comes in, and I don't know about you, Ben, but I've seen hundreds of people like this because I also worked in the ER for a while. Doc, I was fine. I walked up a hill with my wife. I felt a little chest pain. She made me go to the cardiologist. He did some tests, said I have a 95% blockage. If I block anymore, because they always wag their finger at him, that you're going to die of a heart attack. You ever hear that story?
Oh, yeah. Lots of times.
Hundreds of times. Think about that for a minute. He was just told, usually he, that he's got 5% blood flow to a major part of his heart. Right?
Yeah.
How did he walk up that hill?
Good question.
And you mean to tell me, not you, if he blocks from 95 to 97%, right? That's 3. Now he's got 3%. Boom, curtains. That's going to kill you.
Something doesn't sound right about that.
Something didn't sound right about that to me either. So I said, you got to be kidding here. Because as far as I can see, 3% is the same as 5%. You got no blood flow to your arteries, to your heart. So then I decided, as you would think every doctor would do, I'm going to go look at autopsy studies, right? People who died allegedly of heart attacks, right?
Yeah.
How many of them actually had a blocked artery leading to that part of the heart that died? And interestingly, if you go back to the 40s when they started this theory, the cardiologist said, no, that's bullshit. Because we think the people who have more blocked arteries, they have less heart attacks because they make better collaterals. So they didn't buy it. So they did studies. They did autopsy studies, which is the only way to tell, right? You get somebody, this part of their heart died, that's the left coronary artery. You see if the artery is blocked. There's been about 10 studies. Some of them are in my book. The lowest one was 18%. In other words, 18% of the people who had a heart attack and died, right? So it's the worst of the worst, even have a blockage in the artery leading to that part of their heart. And the highest is 78%. Now, that doesn't mean that the blockage caused the heart attack, right? All you know is it's there, unless you're scientifically illiterate, and then you think if there's a fire and you see firemen, the firemen must have caused the fire.
Right.
That's called illogical thinking. But that's how doctors think. Well, there's a plaque, so it must have caused the heart attack. Anyways, a guy named Giorgio Baroldi, Italian pathologist, does a 50-year study on people who died of heart attacks, dissected their heart, their arteries. He comes out with the best number. 41% of people who die of heart attacks have a blocked artery, and at least half of them come after the blockage, not before. So the best number we can have for what percentage of people who have a fatal heart attack, right? This is the worst of the worst, even have a significant blockage before the heart attack, which is not the cause, right? We don't know that yet, is 20%. Which means you got to ask, what happened to the other 80%? What happened to them? Bypasses or drugs to reduce plaque, right? Because that's what they're meant to do, will never work. And in fact, all of the studies on stents and bypasses and cholesterol show they have no improvement in longevity. They don't prevent heart attacks. And the best study on stents showed that it didn't even reduce chest pain, because it was in the Lancet 2018. They, for the first time, did the first blinded trial of stents, 50 people with chest pain. They did stents, 50 people with chest pain. They put a thing in. They didn't do the stent, but told them they did, right? So it's a controlled study. Had 8 weeks later, they had the same amount of chest pain. Exactly what you would predict if this model was wrong.
Mm-hmm.
Now, that means every part of the model is wrong. That means all the blood to our heart is not through those arteries. In fact, only about 10% is. If you look at the actual blood flow to the heart, 90% of the blood flow is through so-called collateral vessels. That's a fact. And so dealing with plaque in major arteries is basically irrelevant. So that's not true. Depositing cholesterol, LDL, HDL, inflammation, or whatever anybody wants to say, causes the plaque, like all the alternative doctors do, right?
Yep.
It's not LDL, or it's not, it's inflammation, or it's whatever. That's also nonsense, because it isn't even the plaque that's the problem. And then the final thing is, you cannot, most heart attacks, the vast majority, have nothing to do with the arteries. So that's what I mean by that. Those claims are now falsified. So whether or not I have a different explanation or can tell you who my real parents are, doesn't impact whether they're still false. If you want to think scientifically, most people don't, but that's how a scientist is meant to think.
Yeah.
Now, you can work on this enough and do other information, and try to put these pieces together and come out with a different way of looking at this, which, if you want, I can explain that. But I just want to emphasize, we're not talking about like evaluating competing theories here. The first model is wrong. So whether or not whatever I say is wrong too has no impact. You can't go and say, well, that must be the first one. No, that one's wrong. I do this a lot. I say to people, you see these dots?
Yep.
Are they on a straight line?
No.
How do you know that?
I can see with my eyeballs. One's up
Right.
top.
Or here's the way I would put it. You don't need a debate. You don't need a go to Harvard train. You need a ruler. Once you do a ruler, you see they're not on a straight line. And no matter what else, you're never going to go back and say, well, if I can't prove what the shape is, then I'll say they're on a straight line. Right? That's nonsense. Yep. So what do we know? We know that certain organs, particularly the heart, and not the spleen, and not your leg, and not your kidneys, and not your liver, and not your foot, have attacks, meaning necrosis of the tissue. That's a fact. Second of all, so we can say, what's the difference? So we know now that the difference is the arteries are the same and the blood is the same. There's got to be something different about the heart than the spleen. So this can get a little complicated, but I'm sure you know a lot about this, Ben. We have a metabolism that is supposedly using oxygen, although it turns out that's a myth too, but let's just say it does. And so you do oxidative phosphorylation happens in the mitochondria, which are the only organelle in a cell that's actually real. We don't have ribosomes. We don't have an endoplasmic reticulum. We don't have a Golgi apparatus. We don't have lysosomes. These are all electron microscope artifacts, and that's a whole different story. But we do have mitochondria, and they produce something called ATP, which, by the way, isn't energy. That's another myth in science. We don't have time to get into that either, but I can tell you, I'm sure that's correct. So generally speaking, you make energy, which is essentially an electromagnetic flow. And the heart out of that creates a torus field, which essentially is like the energy milieu of the body, right? So heart, most mitochondria, most energy creates this electromagnetic field, which you can pick up on an EKG, and that's the energy field, and that's a healthy heart. If you poison the heart, and you can do that with emotions, wonky thinking, heavy metals, bad food, you know, all kinds of stuff, then you will get a decreased metabolism of the heart, and it will start using what's called fermentation or anaerobic glycolysis. And that builds up lactic acid in the tissue, just like it does with your leg, right? If your leg muscle exceeds its capacity, it starts building up lactic acid, and you get cramps and pain in your leg, right? Get cramps and pain in your heart. We call that angina. Here's the difference. The spleen and the liver and the kidneys and the leg, they stop because they can stop. The lactic acid gets flushed out, and they don't go on to necrosis. The heart has to continually expand and contract, which is not pumping, by the way. There's the idea that the heart pumps the blood is patently false. That's a whole nother story. But it does expand and contract. It can't stop because the blood has to continue to circulate. And so the lactic acid continues to build up, and that causes a tissue acidosis, which destroys the tissue. And we call that a heart attack. Then, interestingly, it's like a river that a beaver puts a dam in, and then you get debris upstream from the river. You see debris, meaning plaque, upstream in the arteries from the area of necrosis, and you erroneously think that debris caused the beavers to build the dam. It didn't. They were a consequence, which is why the plaque comes after the heart attack or this metabolic deficiency of the heart. And that way of looking at it conforms to every single experimental fact you can find about the heart, including the fact that if you do it with animal studies, you never measure a lower oxygen level before a heart attack, but you always measure a lowered pH. Always. There is no other mechanism to get necrosis of the tissue but a lowered pH from a disturbed metabolism. So this is an energy problem because of a disturbed energy flow, which then gets into another major cause of why do you have a disturbed energy flow? Because we live in an altered electromagnetic field environment, right? We're supposed to have an electromagnetic field environment based on the sun and the moon and the earth and plants and animals and the ether that circulates around us, etc. Instead, we have Wi-Fi, which is single frequency, high intensity, toxic electromagnetic fields. And then we put in certain metals which seem to attract these fields. And then we get a decreased energy flow in the heart, which then builds up lactic acid, which forms, an acidity in the tissues, which then causes necrosis. And that's why we have heart attacks. Now, whether that theory is right, which I would say it is, it still has no impact on whether it's from plaque. That's the important point I want to make. So I'll stop there.
Yeah. And I want to reiterate and a little bit summarize, because if you're a new listener, it might shock you a little bit. What Dr. Cowan said earlier, that 2018 study from the Lancet, you put a stent in or you do a bypass, that study was on stents and chest pain, but they've done the same thing with bypasses. That's not preventing future heart attack and strokes. Just rerouting this plumbing or opening up that, plaque build up, that 95% blockage, and also statins, 0.8% reduction cardiovascular mortality. That's, I believe that was JAMA 2022. They did a review study of all statin data, 0.8% reduction. So
By the way, let me just point out something there, Ben.
Yep.
When they do that 0.8% reduction, people have to realize that's a relative risk assessment. And what I mean by that is if you had 3 people you were evaluating and you did intervention X, and instead of 2 people dying of whatever of the 3, you had 1, right? And if you ask a doctor, what's the decrease in risk or the improvement, they would say 33%. Because 2/3 is 66%, 1/3 is 33%. 66 is better than 1, is 33% higher than 33%. That's called relative risk reduction.
Yeah.
Or in other words, if you assess 1 million people and you do intervention X and 1 person dies of a heart attack, you do nothing and 2 people, and you say, what is the improvement in the incidence? It's 33%. Because 2 out of 3 you did nothing, died. 1 out of 3 who you did the drug, they died. That's a reduction of 33%. Whereas everybody with any sense, who's not, as I call them now, scientifically illiterate, would say that is a 0.00 whatever 1% reduction, which is insignificant.
Yeah.
Now, the reason why I know that this is, it's hard to know the word, but fraud, is then they report the side effects. In other words, what's the all-cause death rate? Well, it's 100 in the no treatment and 1,000 in the treatment. But that's only a 0.009% risk. So that's no big deal. So we're good.
Yeah.
That is, I mean, if you fall for that, I don't know what to say. You deserve it or something. But,
well,
that's what I mean by illiterate.
Yeah. And I'm going to just reiterate to the audience. These doctors, and I'll say me, but I'm pretty sure you can translate this, fill in the blank with your doctor. We're busy. I was seeing 50 patients a day in a little tiny county clinic, just trying to keep the taxpayers happy and thinking I was doing the right thing. And a drug rep runs in there, has 5 minutes maybe with me, brings in this nice shiny poster board for Lipitor. And there's this bar graph that shows 36% decrease in mortality. And this tiny, and I mean, in that little brief moment, number one, I'm trusting the drug company. I'm trusting the drug rep. I'm trusting that poster board. Why would they be lying to me? Man, 33%. Come on, let's go. Maybe I should get on this too. But so no one has time. Number one, we trust inappropriately. And then we don't have time to go look. And the truth on that study, and by the way, they'll put a big famous doctor, cardiovascular surgeon out there saying, I take this and you should too. So then you're really trusting. I mean, this is a top guy. But you go read the fine print. It's just what Dr. Cowan was saying. In a randomized controlled trial, placebo-controlled trial, this means that 3% of the people in the trial had a heart attack who took the sugar pill. 2% of the people had a heart attack in the trial who took the Lipitor. That's a 1% difference. How can they put 33% up on this shiny poster board that I have 5 minutes with the drug rep to look at and have no time to dig into? We trust these institutions. We trust these advisory boards that put out this standard of care. And Dr. Cowan's already alluded to it. If this theory were true, then bypass, stent, and Lipitor would work. We would see a decrease, a significant decrease in cardiovascular disease. And we're seeing the opposite, increase. It's the number one killer, and it's increasing almost to 700,000 now. So just that right there is enough to say time out and pause. Okay.
But Ben, I must say, I got it. It's not just trust. Your doctor, even that cardiologist, is not capable of understanding what those numbers mean.
Agreed.
It doesn't matter. I've been over there. They always say, "Oh, I don't have time and I'm so friggin' busy." It's not that. You could sit that guy in a room for a week and say, try to figure this out. At the end of the week, he wouldn't do it. Because he is scientific, he or she, I shouldn't be sexist here, is scientifically illiterate. And they don't ask, and if you don't believe me, go and ask, is this relative or absolute risk reduction?
Yeah.
I don't know what that means. What do you mean you don't know what that means? That's 2 out of 3 instead of 1 out of 3. And show me the so-called side effect. There are no side effects. This is pure poison. So show me the poisoning effects. Well, those are 0.2%. How did you get that number? They don't know. That's what I mean by illiterate. And they can sit there for a week and they still won't know. So business of it's too busy and they're too, it's not that. This is I now come out with the, you may disagree with this, but because it was me too. Like, I'm not excluding myself. Going to medical school in our educational system is acquiring a thought disorder. That is sometimes called schizophrenia. But if you made it through your training, you now have a thought disorder, because as soon as somebody says, prove to me that chickenpox is caused by a virus, you say, yeah, but how did my Aunt Bessie get chickenpox when she walked in a room? That is an illiterate response to the need for a scientific proof that there is this particle and it causes this disease. Because there's a whole lot of reasons why Aunt Bessie could have got sick, or your child, or et cetera, or they'll throw the rabies one at you. Even though there's this hospital in Philadelphia, dog hospital, they've had 150,000 people, workers there over 50 years, 150,000 dog bites, not one case of rabies. 80% of the reported cases of rabies by the CDC, the people had no contact of any sort with any animal in the last 6 months. Those are the facts. But they say, well, how do you explain that? This is illiterate.
Yeah, I would agree. We are quite illiterate, no doubt about it. And unfortunately, this education system, which we could have a whole nother hour discussion on that. I want to circle back because I do want to touch on this. We have talked. We'll have to have part 2 or part 3 and 4 too later. I want to drive this point home. This energetics thing, this toroidal field you talked about. because there is a blood clot involved. We didn't really talk about that. These pipes can have a blood clot that blocks flow downstream, just like the Beaver's Dam, so to speak. And we know there's this inner lining of the arteries, the glycocalyx. This has a negative charge, has structured water, H3O2, exclusion zone, whatever you want to call it, that kind of repels things off the wall of that artery. We've seen, we've had Dr. Malcolm Kendrick on here, his book, The Clot Thickens, and he gets it right down to basically blood clots are the issue. But to go deeper, there's something going on with the wall that allows that clot to manifest. And this is where we can jump over. And if you get Dr. Cowan's book, again, I want to stress Human Heart, Cosmic Heart. He goes through this whole thing. And it's not
blood clots are a consequence, not the cause.
Exactly. So keep going deeper. Something's causing the inner lining of that blood vessel wall to no longer repel particulate matter, and a clot can form. So something's damaging that, in particular, the energetics of that, the negative charge on that wall. Something has happened to diminish that negative charge. And that's where you start to really get into more of this other theory, and you can kind of connect these. But like Dr. Cowan said, the other theory's off, totally off.
Hang on. What do you mean by a negative charge?
A force that's going to repel, like the opposite ends of a magnet, a repelling force. That's what I would say.
Got it. Because the physicists love to do that. They say there's antimatter. Mm. And you say, whoa, like, what do you mean by anti? Well,
I mean 95% of the matter, right? The dark matter.
Yeah, 95% of the universe is antimatter. I mean, so here's the way
scientifically illiterate now, Dr. Cowan. Come on.
Here's the way. Here's the way science works these days. You come up with a theory, right? And then eventually somebody falsifies the theory. And rather than going back and saying, yeah, that theory or that model, because we live, science is now, instead of reality, it's models. Mm-hmm. So then somebody falsifies the model or says some fact that disproves your model, and then instead of saying, yeah, the model's wrong, you make up another, usually what's called a reification fallacy, which means you're ascribing properties to something that doesn't exist to keep the theory going. Here's what I mean. By the way, I don't know if you know this, but the reason that the buildings in the Ukraine are blowing up is because of exploding unicorns. Now, somebody might ask me, have you seen these exploding unicorns in the Ukraine blowing up the buildings? Right? That's a reasonable question.
Yeah.
And I would say no. And that falsifies the theory, right? Because there are no. But I come back and say, well, Ben, that's because they're invisible exploding unicorns. Oh, and then you see, I've reified the unicorns. I've made them real and ascribed them properties. Now, if you think that's ridiculous, because it is, how about this? The flu virus makes everybody sick, right?
Yeah.
The virus gets in, reproduces, etc., makes you sick. Yeah, but how come Uncle Fred, he got sick, and Aunt Rose, she didn't get sick? Right? So you've now falsified that claim. Well, that's because Aunt Rose has a good immune system. Right? So now you've added another layer of, well, yeah, but how come you know that there's unicorns if they're invisible and you can't see them? Ben, are you saying that the buildings aren't blown up? That's the next thing they say. Are you saying Uncle Fred didn't get sick? No, I'm not saying the buildings didn't get blown up or Uncle Fred didn't get sick or you didn't have a heart attack. I'm saying we falsified your explanation as the cause. And just because you say your immune system protects them. So then you say, what is the immune system based on? It's based on antibodies, right? That's what they say.
Yeah.
Now, here, that's because antibodies protect you for life against the virus, right? You get the measles virus, you get antibodies, and then you're protected for life. You get chickenpox, you get antibodies, and then you're protected for life. Except if you get shingles, and then that was because the virus evaded the immune system, evaded the antibody. And if you get HIV, then not only are you not protected for life, but now the antibodies mean you're going to die of this deadly virus. See, wait a minute, you just told me if I have antibodies, I'm protected for life. Yeah, but not with HIV. That's a smart virus that knows how to evade your antibodies, whereas the measles virus, that's a stupid virus, and it doesn't know how to evade your antibodies, so that's why you're protected for life. Whereas the flu virus, that's an intermediate, smart, stupid virus. So sometimes you're immune for life, for a year anyways. Then it evades you. So that's why you need a new flu shot the next year, because the flu virus figures out in a year how to evade your antibodies. So you need a new flu shot the next year. The next thing you know, you're swimming in nonsense, trying to figure out where are these exploding unicorns and whether they're really invisible and who put them there. And that's what happens here.
Yeah. Well, it reminds me of that quote from Mark Twain. It's not what you don't know that gets you in trouble. It's what you know for sure that just ain't so.
Or W.C. Fields, who said, if you can't dazzle them with brilliance, baffle them with bullshit. That's what we're talking about here. It's a big word. So it's not the antibodies, it's the epitome of your antibody. Because you're always forced to get smaller and smaller and smaller to keep the story going.
Mm-hmm. Yeah.
That's what we got.
Yeah. Well, I want to throw this in. We've got a few more minutes. Dr. Lee Cowan, not to be confused with Cowan, but Lee Cowan, Academy of Comprehensive Integrative Medicine. He came out to our clinic here in Lubbock it's been 10 years ago. I was brand new, didn't really know what I was doing, and I was chasing germs at the time, integratively, Candida mostly, from Dr. Roby Mitchell's mentorship. He was the first doctor I met outside the box. But anyway, so that's what I was doing. I saw this type 1 diabetic. She was 55 years old. All of a sudden, her pancreas quit working. Her blood sugar's 800, and they called her type 1, put her on an insulin pump, and she came to see me. And based off her history, it sounded like with the standard American sugar, processed sugar, and high fructose corn syrup drinks, she probably had a lot of candida. She'd been on lots of antibiotics. So this imbalance of her microbiome, and candida was in her pancreas, and her immune system's going to go get it, and knocked out her pancreas as friendly fire collateral damage. I looked at Dr. Cowden and said, do you have any input or thoughts on this case? And he said, I only have one question. When was a sweetness taken from your life? He asked the patient. The patient proceeded to break down crying and said her daughter that she'd raised for 13 years had suddenly been stripped from her home and her life because mom had moved back into the picture and took the little girl away. And Dr. Cowden told me, Ben, you can kill alligators all day long, but if you don't drain the swamp, the alligators come back. He went on to explain these energetics and force fields is kind of how I talk about it. And this is probably going to open up a can of worms, but the periodic chart and the atoms, hydrogen, carbon, nitrogen, protons and neutrons in the nucleus, electrons buzz around that nucleus, but 99% of that atom's empty space, empty of particles. And it's not empty from a force and energetic standpoint. And there's attractive forces and there's unattractive forces, things that repel, things that attract. So maybe there's some physical matter involved as far as heavy metals or toxins or germs or whatever. But it's more about the energetics, and the energetics are actually impacted most by the frontal lobe, by what you're thinking, your beliefs. Not to say, that there's not the physical component. I'll tell people, if you held me underwater for 10 minutes, I'm not going to be living when you pull me up. Probably we were designed to breathe. We're not fish. Probably I can't go drink glyphosate or whatever. There's the physical piece of it, but we're this interplay, the physical and the non-physical together. And that is the part that I think leads to so much of the issue is we're not trained in this at all. We're trained totally in particle only. And we're trained that there's these smart doctors that know all about these particles. And therefore, let's try to manipulate them. And then no one's taking the big picture look of, hey, this whole thing ain't working. We're dying younger than ever. Our ancestors didn't know anything about atoms, energetics, or attractive and repelling forces. They were healthy. And what do you look at? And this is what you're going to find in Dr. Cowan's book. I'll just get you to the end, but still go read it because it's a great book. And it's going to tie this all together. You need to be outside in nature. He alluded to it earlier. Animals, sunshine, the dirt. I don't think he mentioned loving relationships, but I bet he will in the last few minutes here. There's these basic things of just human life that produce health, and it's not that hard. It's not that complicated. You can be the cure. You don't necessarily need a doctor. In fact, I got to find this study. I don't know if you've heard of it. Someone told me the cardiologists in Canada, this was years ago, pre-COVID, they all go to a conference, the Cardiology Conference of Canada Medical Association, one weekend out of the year, same weekend every year. And they looked at cardiovascular outcomes, and that year, or that weekend of the whole year, it's the least cardiovascular death of any weekend of the year. It's because the cardiologists aren't there. There's no time to go into this. Is doctors being the leading cause of death in America? Conservative estimates would put that number 3. I'd put it number 1. But by any way you look at this, that the way we're thinking and operating in the conventional day-to-day doctor realm, it's producing awful results. And I would submit to you to consider, we don't even think about this, not this supernatural, energetic, and the book explains it more. So get the book. But
by the way, Ben, I just want to pipe in. It is very clear that there's no such thing as this nuclear atom. And by the way, you can get we've heard about the protons and the neutron and the spinning electrons in orbit. Erwin Schrödinger, one of the foremost proponents and people who came up with this theory, says, oh, by the way, if you looked in an atom, you'd never see an electron. They don't exist. They are a theoretical model. And we keep the story going because that's the story we got. And you're absolutely right. And this Lee Cowan guy was absolutely right. We are electromagnetic beings, and we've been fooled, deluded into thinking there's something else going on here. And when you stick to like the Sherlock Holmes method, he said, when you get rid of everything that's not true, you'll find out what real truth is. Just stick to that method. Just one thing after another. Can you falsify this claim? Can you justify this claim? And you find that most of them, they can't. And you have to live in that uncomfortable place of, I don't really know what's true right now. And then somehow the world helps you out. And I've seen that over and over again in my life. If I'm willing to just say, I don't know.
Yeah.
The world's next day, somebody says, here, read this. So you figure it out. I do. But if you can't stay there, you're going to end up thinking the same nonsense as when you started.
Yeah. And doctors are probably one of the worst groups to be able to say, I don't know. Yeah. Well, here's the final quote. I'll give you the last word. Albert Einstein said, the intuitive mind is a sacred gift, and the rational mind is a faithful servant. We have created a society that honors the servant and has forgotten the gift. And I would say Dr. Tom Cowan has not done that. The intuitive mind. When you listen, I encourage you, go to his website, drtomcowan.com. He has lots of information there. The books, it's going to give you permission to expand your mind and to keep exploring and to be okay with living in that space of, I don't know. and keep searching and keep looking and let that intuitive mind grow instead of this rational, logical thing dominating. It's so easy to manipulate with smart doctors. So, Dr. Cowan, thank you for all you do, for your books, your website, all your times you've been on my show. It's always fun. Although I think now you've thrown enough nuggets of, wait a minute, like the atom. We might have to have you back to go through some of these other things, but I know you're a busy man, so thank you today for joining us.
Okay, Ben. Thank you.
You bet. All right, everybody. Dr. Tom Cowan. I'm Dr.
All right,
Ben Edwards. You're the Cure. We'll be back next week with another great show. See you next time.